Hello, I'm Lee, and I'm here to talk about the emerging pharmacology role of the endocannabinoid signaling system. Okay, first off, endocannabinoids play a crucial role in neuromodularity, affecting appetite, reducing pain sensitivity, involved in sense, with a crucial role in the inverse of memory, equally as important enabling you to forget. The neuromedullary role acts as a cushion by inhibiting presynaptic neurotransmitter release, synaptic crosstalk and metaplasticity. In a sense, endocannabinoids conduct many functions by buffering chemical messages. Employ two key G protein receptors, CB1 found mainly in the brain and CB2 found mainly in the immune system and hematopoietic cells, complementing, found in most animals.
Perhaps a primitive system?
The human body synthesizes the endogenous cannabinoid anandamide, from enerichidin oil phosphatidylethanolamine, derived from Sanskrit and Buddhist principles. The word, ananda, means blissfulness, a worthy title for the arachidonic acid derivative that binds competitively to the CB receptors, with cannabimimetic activity to delta-9-tetrahydrocannabinol, or THC. The pharmacology principle is currently being researched for multiple sclerosis, Alzheimer's disease, Parkinson's disease, epilepsy, rheumatoid arthritis, various mental illnesses, and a breakthrough for the holy grail of medical research, cancer, making it the equivalent of Viagra, for therapeutic use. A hallmark of cancer, angiogenesis, genesis of blood vessels, fortifies tumor cells and supports the malignant fate of tumor growth, distinctly different to the architecture in healthy vessels' blood supply, a dependent factor for solid tumors, including breast cancer, hepatoma, bladder cancer, gastric cancer, prostate cancer and the notorious glioblastoma, for its ability to weave instinctively inside brain tissue. Formation of new blood vessels target receptor tyrosine kinases, RTKs, expressing vascular endothelial growth factor, or VEGF, in cell signaling pathways concerning angiogenesis and vasculogenesis. The process requires a finely tuned balance between stimulatory and inhibitory growth factors, integrins, angiopoietins and chemokines, oxygen sensory signals and endogenous inhibitors, etc. Anti-angiogenic agents inhibit the production of new blood vessels. The irregular construction and molecular and structural basis is a potential opportunity for selective inhibition or targeted destruction of tumor vessels, utilizing selective angiogenesis inhibitors, without affecting normal vasculature. Cannabinoid receptors CB1 and CB2, an endogenous ligand, control several physiological and pathological processes such as cell survival, or apoptosis, and proliferation. A growing body of evidence also suggests the endocannabinoid system are also involved in tumor growth and metastasis therapies. The activation of CB1 receptors inhibit angiogenesis via reticence and VEGF expression, interfering with endothelial cell migration and inducing endothelial cell apoptosis, thereby retarding malignant angioma growth. Further evidence suggests the cannabinoid system is associated with transcription factor NF-κB, towards regulating cell death or survival. Cannabinoids in modern medicine. Dronabinol, a synthetic THC used in the treatment of nausea and vomiting for cancer and autoimmune compromised patients, appetite stimulant, analgesic to ease neuropathic pain and multiple sclerosis. Nabilone, a synthetic THC, a nervous system active drug, is used in the treatment of nausea and vomiting during cancer treatment, with warnings on potential effect on mental states, notionally psychoactive, with CB1 selectivity, testing for chemotherapeutic-induced neuropathic pain. Dexanabinol, a synthetic non-psychotropic cannabinoid that blocks the NMDA receptors and COX-2 cytokines and chemokines, neuroprotective, protecting the brain from damaging insults, for use after cardiac surgery, to recoup memory and high-level functions following traumatic brain injury, with promising esteem as a future anti-cancer drug, favored as a drug to be safe, however, not effective in the treatment of traumatic brain injury. All is not lost, currently being studied in treating brain cancer, beginning 2012. CT3-agrolimic acid, a synthetic analog of THC, for the treatment of spasticity and neuropathic pain in MS patients, anti-inflammatory properties for arthritis. Cannabina, synthetic, with specificity to CB2, with anti-inflammatory and chronic pain relief, with emphasis on neuropathic nerve pain, and bladder control. HU308, synthetic with specificity to CB2, used for hypertension and anti-inflammatory. Rimonabant antiranabant, synthetic, an inverse agonist for CB1, used for appetite suppression and in treating obesity. METFAEA, metabolically stable analog anandamide, 2-methyl-2-F-anandamide, found to inhibit growth of thyroid cancer, in vivo. Bevacizumab, not a cannabinoid, however worthy of mentioning being an inhibitor of VEGT, and used in the treatment of solid malignancies.